this is where traditional care can fall short, because focusing on symptoms when there are no symptoms is going to cause you to miss something that is underneath the radar. So we often miss this root cause problem that has been going on for oftentimes years without people noticing.
Welcome to Health Decode, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
All right, welcome to episode 3 of Health Decoded. Today's episode, I'm Dr. Alfred Alessi. Today's episode, we are going to be talking about inflammation and, more importantly, decoding inflammation and what we call the silent health saboteur. And now, why do we call it this is because oftentimes inflammation can go unnoticed and unmanaged in the body. I want to thank you for joining us. I want to thank you for coming back on the show. If you listened to our last episode, we discussed root cause medicine and how it differs from the standard conventional Western medicine approach, which is very much focused on symptoms and addressing just pain relief and symptom relief versus getting to the bottom of an issue, or the root cause, as we call it, and really fixing the problem. So as always, if you've been listening to the show and you're enjoying it, please sign up for our newsletter. You can go to alessifunctionalhealth.com, sign up for the newsletter to stay informed. Subscribe so you don't miss any episodes of the show every Tuesday, and share this with somebody who you think would benefit from the information that we are discussing on the show. So we have a really awesome episode today, tons of information. This is going to be probably enlightening to a lot of people, and just a topic that I believe is very important because it has snowballed over the last decade of becoming from a buzzword to just a real problem in our society and in our country, the concept of chronic inflammation. Now, I just really quickly want to set the stage for what this episode is going to be about. Today's conversation, we are going to decode the mystery of inflammation, separating the good from the bad. Let's dive into how chronic inflammation develops, its root causes, and why it's often overlooked in traditional symptom-based healthcare. Importantly, we're going to explore actionable strategies to address inflammation at its root, empowering you to take control of your health, reduce disease risk, and optimize your well-being. And really, inflammation is not just about managing symptoms. It's about understanding the why behind them, making sustainable changes to restore balance, and then live an optimal, healthy lifestyle. So thank you for joining me. Let's dive right in. So why did we choose this topic, and why is this something important for everyone to have knowledge about? Is because inflammation is good and bad. And, it really is a protective mechanism in the body, but when left out of balance and unchecked, inflammation can become detrimental and often life-threatening. So chronic inflammation is actually linked to 3 out of the 5 leading causes of death worldwide, basically saying that a majority of deaths can be prevented by managing chronic inflammation or preventing issues that cause inflammation. So what is inflammation, right? Let's start with that. Inflammation is a natural and essential biological process that occurs when your immune system detects injury, infection, or harmful substances in the body, such as toxins or chemicals. It's your body's way of protecting and healing itself. When you cut your finger or you get a cold, your immune system springs into action, releasing chemical signals that attract the immune cells to the affected area. This acute inflammatory response is beneficial. It fights off infections, repairs damaged tissues, and it helps restore your body to its normal state. So this protective mechanism is a good thing. This is something that we want, something that should happen. When you work out too hard, your body feels sore and tired. That's inflammation. It's a good thing. It's rebuilding. However, inflammation isn't always helpful. When it becomes chronic, persisting for weeks, months, or even years, it can turn from a protective mechanism into a destructive force. Chronic inflammation occurs when the immune system is constantly triggered, often due to underlying issues like poor diet, chronic stress, environmental toxins, or unresolved infections. These are latent pathogens possibly living in the body, parasites, mold, heavy metals. These things can constantly trigger that inflammatory immune response. And the problem is that chronic inflammation doesn't announce itself with obvious symptoms. It quietly works in the background, causing damage to tissues and organs over time. And this is why we refer to it as a silent saboteur. So, as we said, inflammation is beneficial, helps the body heal and recover. It is a cornerstone of your body's natural defense system. When you experience the injury, infection, or irritation, your immune system then leaps into action, triggering that inflammatory response to protect and, here's the key word, repair the affected area, right? Your body's always trying to heal and repair and regenerate. So you can really think of it as your body's built-in emergency response team, working swiftly and efficiently to contain damage and begin the healing process. So here's how that acute inflammation works. This is what happens inside the body. First, the alarm gets triggered, right? Your body detects a problem, like a sprained ankle or some kind of invading bacteria. It sends out chemical signals, such as histamines and cytokines, to alert your immune system. What happens next? Increased blood flow. So these signals cause blood vessels to dilate. That means get wider, increasing blood flow to the affected area. This delivers oxygen, nutrients, and immune cells to where they're needed most. So it's basically opening the floodgates so that the good guys can come and get to the area. This is why a swollen area like a sprained ankle often looks red, feels warm. This is a sign of that increased blood flow and circulation. Next, the body recruits immune cells. White blood cells, like neutrophils and macrophages, rush to the site to neutralize these harmful invaders and clean up damaged tissue. Then it facilitates the repair. So the immune cells release growth factors that stimulate tissue regeneration and repair. Much like that working out example I mentioned. When you work out, your body feels sore, you have torn down muscle fibers and broken down tissue. Your body repairs, rebuilds stronger, right? Think of like scaffolding on a building that they're repairing. The building was good, but there were some internal issues. They put the scaffolding up, then they fix everything, and then they take it down, and now it's better, right? And so, I think the best example most people can align with is the twisted ankle or the sprained ankle. It swells, it becomes tender. Again, this swelling is a result of fluid and immune cells flooding to the area to protect and begin the healing process. While it does feel uncomfortable, it is a sign that your body's working to repair that damage. Another great example is when you get a fever during an infection. A lot of people want to reduce the fever, but in fact, the fever is actually a good thing. The fever is your body's positive response to an infection. When you have the flu, your body raises its temperature to create an environment that's less hospitable to invading viruses or bacteria. So it's basically trying to push the bad guys out while it's bringing the good guys in. Now, while fevers can feel miserable and annoying, and obviously they are not comfortable, it's a very important tool in your immune system's arsenal to help fight off that infection more effectively. So why is acute inflammation a good thing? Because it's fast acting and targeted. It responds only to the areas where it's needed. It helps to prevent further injury or infection by isolating the problem. And it's temporary, only lasting until the issue is resolved. So in essence, acute inflammation is a lifesaver. It's your body's way of saying, hey, I've got this. Give me some time to repair and recover. Understanding that this process helps us appreciate why a little swelling or discomfort isn't always bad, right? The same reason, again, I keep going back to the workout analogy. When you work out, you should have a little bit of soreness. That means you did a good job and your body is now going to repair. It's doing exactly what it's designed to do. Now, when does inflammation shift from a positive, beneficial thing to now harmful? And this is when it becomes chronic, when lifestyle factors may cause a high level of inflammation. Things like stress, poor diet, environmental toxins, or even working out too much can be one. This is something we see a lot. And so some of the hidden dangers of chronic inflammation are things like heart disease, diabetes, autoimmune disorders, digestive issues such as IBS or leaky gut, and even things like cognitive decline and Alzheimer's. Alzheimer's is actually more commonly known now as type 3 diabetes due to the inflammatory nature that occurs within the brain due to high blood sugar. That excess sugar in the blood is inflammatory to the nervous system. And so again, The roles of inflammation in health and disease. The positive is the acute inflammation helps with wound healing and fighting off infections. It's a key player in the immune response and tissue regeneration. However, the negative role is in things like heart disease. Chronic inflammation contributes to the buildup of plaque in arteries, which is a hallmark of cardiovascular disease. Elevated levels of C-reactive protein, or CRP, is a marker of inflammation strongly linked to heart attack risk. Something that we look for as functional medicine providers on almost all blood work is a level of C-reactive protein. Inflammation is persistent in diabetes and can interfere with insulin signaling, leading to insulin resistance, which is basically a precursor to type 2 diabetes. It is present in autoimmune conditions like rheumatoid arthritis or lupus. The immune system is mistakenly attacking healthy tissue driven by this chronic inflammation. We discussed that in our last episode, Root Cause Medicine. So go back and listen to that. It'll make a little bit more sense. Inflammation is highly present in cancer. Chronic inflammation can promote tumor growth by supplying cancer cells with growth factors and creating a conducive environment for their survival. And like I said, neurodegenerative diseases, chronic brain inflammation is implicated in conditions like Alzheimer's and Parkinson's disease. And so oftentimes, many of those things I just talked about, those diseases, cognitive disease, cancer, autoimmune, diabetes, heart disease, there's not an initial sign that these are coming until perhaps you get some blood work and you realize, wow, there's a problem. And so that's why we talk about it as this silent saboteur kind of lurking underneath the radar until disease sets in. And so it progresses, chronic inflammation, unlike acute inflammation, progresses slowly and quietly, often no noticeable symptoms until significant damage has been done. It is contributing to the aging process. Obviously, it has earned the nickname inflammaging, is now a term being used to talk about the aging process that is coming from this chronic inflammation. It disrupts hormonal balance. It impairs gut health and healing, and it weakens your immune system over time, leaving you more vulnerable to diseases. So, this is where traditional care can fall short, because focusing on symptoms when there are no symptoms is going to cause you to miss something that is underneath the radar. So we often miss this root cause problem that has been going on for oftentimes years without people noticing. So one of the most common frustrations we hear from patients is, I've been treating this problem for years, but it keeps coming back. And that's because many of the conventional treatments are symptom focused. They aim to manage pain, fatigue, or discomfort without asking why these symptoms are happening in the first place. Chronic inflammation is often under the radar because it doesn't always present like acute inflammation with swelling or redness. Instead, it operates silently, fueling a host of seemingly unrelated issues like fatigue, joint pain, digestive problems, or even anxiety and depression. Things that people think they just have to live with and they kind of just power through on a daily basis, not realizing these are actual issues being caused by a root cause problem, that being inflammation. And so a good example, I want to share a real life example of, resolving chronic inflammation to address said health issue. So we saw a patient, let's just call her Sarah, not her real name, but she didn't want us sharing. So she came to us with chronic joint pain and fatigue. She'd been prescribed pain relievers, antidepressants, because her symptoms had been affecting her mental health, although her depression and mental health was not the cause. So again, put on multiple medications. None of the doctors she had seen, and she had been to a few, really dug deep enough to understand why she was feeling this way. And so through some testing, we found that she had markers of systemic inflammation linked to diet and gut health. We ran a pretty comprehensive panel on her, over 100 different food sensitivities. She had basically leaky gut, SIBO, overgrowth of candida, and she was consuming foods that she didn't realize were causing inflammation. One in particular being gluten, this is a very common thing we see, and highly processed foods, things high in sugar and, seed oils and processed chemicals. So what was the approach? Number one, we had to eliminate those. We got rid of those triggers. We started to rebuild her gut, supporting her gut health with things like probiotics, nutrient fiber dense foods. And we incorporated movement to improve circulation. We did this through chiropractic care and a programmed functional movement exercise routine. Just within a few months, her joint pain was nearly gone, if not almost gone. Energy levels were through the roof, and she felt like a different person, and we weren't even done yet. However, we had started with that elimination approach, and it made a dramatic impact on Sarah's life. So, this is why focusing on symptoms will always miss the mark, because without addressing the underlying problem, chronic inflammation, the underlying problem persists and the symptoms will inevitably return. This episode of Health Decoded is brought to you by Authentic Nutrition, the brand redefining what it means to fuel your body the right way. At Authentic Nutrition, they believe that what you put into your body matters. That's why every single product is crafted with clean, premium ingredients and dosed with maximum efficacy to ensure you're not just meeting your health goals, you're exceeding them. No fillers, no shortcuts, no gimmicks. Whether it's their advanced supplements for energy, recovery, or gut health, you can trust that what's on the label is exactly what's in the bottle. Authentic Nutrition delivers science-backed formulations that work as hard as you do. If you're tired of products that promise the world but don't deliver, it's time to make the switch to Authentic Nutrition. Elevate your health with transparency, quality, and results you can feel. Check them out today at AuthenticNutrition.com and use promo code Alessi15 to get 15% off. That's THENTIC Nutrition.com, promo code ALESSI15 to save 15% and take the first step toward real, lasting health. Authentic Nutrition, fuel your best self. Now back to the episode. Let's get into a little bit of nuts and bolts here. The role of lifestyle in chronic inflammation. So modern habits play a significant role in chronic inflammation, and here's how. Poor diet, number one on our list. Diets high in refined sugars, processed foods, and unhealthy fats, they create a perfect storm for inflammation in the body. These foods are going to disrupt gut health, spike blood sugar, and trigger those inflammatory pathways. And so if they're constantly coming in, that is constantly going to be on, right? So studies show that a Western diet rich in processed foods is strongly linked to higher levels of what we talked about earlier, the C-reactive protein, which is a hallmark for inflammation. So focusing on what can we do about it, right? Focusing on an anti-inflammatory diet rich in whole foods like vegetables, fruits, omega-3 fats, lean proteins, such as grass-fed, grass-finished red meat, and things like herbs. Herbs like turmeric, ginger, these are highly anti-inflammatory, incorporating these into our diet. So one of the other things that can then contribute to chronic inflammation, a sedentary lifestyle. So long periods of inactivity slow circulation. It's going to impair your body's lymphatic system from draining, and it's going to allow those inflammatory markers to build up and not be eliminated. A study published in the Journal of Clinical Endocrinology and Metabolism found that just 20 minutes of moderate exercise reduces inflammation markers in the body. So this is why we always encourage daily movement, whether it's a brisk walk, yoga, or strength training, tracking this. So using a watch similar to this one I have here to track your steps. You should be getting around 7,000, if not 8,000 steps a day. More is always better. The next thing that can contribute to chronic inflammation is chronic stress, whether this is mental, emotional stress, physical stress, biochemical stress. Body handles stress all the same. Stress causes the body to release cortisol, which in small doses can be helpful. This is going to help you respond to an emergency. However, chronic stress leads to sustained high cortisol levels, which contribute to chronic inflammation and suppress your body's immune function. It can inhibit your body's ability to balance its circadian rhythm and get rest at night, thus fueling the fire. Research has linked chronic stress to an increased risk of inflammatory conditions like heart disease, diabetes, and autoimmune disorders. So how do we combat this? Incorporating stress reduction techniques such as mindfulness, meditation, journaling, or what we call vitamin N, spending time in nature. All of these things have been shown to lower stress, especially the mental, emotional stress that many people in this country are dealing with. As Americans, we're always go, 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 on. How do we turn it off, right? Another cause of chronic inflammation we have here on the list is environmental factors. And this is probably one of the toughest ones because it is just all around us. Exposure to toxins from pollution in the air, plastics, chemical-laden products. These can overload your body's detoxification system and thus promote inflammation. Poor sleep hygiene, just what we talked about, such as inconsistent sleep patterns or excessive screen with blue lights, disrupts your body's repair process, thus exacerbating inflammation. Studies have found that even one night of poor sleep can increase inflammatory markers in the blood. So what do we do about it? We prioritize clean living by choosing non-toxic products. There is multiple apps that you can use when you're shopping. Scan a barcode of a product, and it tells you a toxicity scale. You want it to be a clean product, minus the phthalates and those BPAs and these chemicals that are what we call forever chemicals because they leach into the skin. If we're talking about topical products, or if you're consuming it, it's getting into the body, and they live in your body because the body doesn't know how to handle them other than to mount an immune response. And so prioritizing the clean living, maintaining consistent and high quality sleep habits are going to help combat chronic inflammation. So takeaway, by focusing on lifestyle factors, we can really address the root cause of inflammation, which is obviously the goal. Rather than just masking symptoms by taking some type of medication. And oftentimes, functional medicine can be vilified by doctors saying they practice functional medicine, but they really are just giving you supplements instead of medication. But the approach is the same. They're not addressing lifestyle. So we must address the lifestyle. Chronic inflammation doesn't have to be inevitable. It's often just a result of modern living habits, the world we live in. By making small, intentional changes, we can empower ourselves to live healthier, inflammation-free lives. And so let's discuss a little bit more and unpack how we can move away from symptom-based care to a more comprehensive root cause approach to health. So I'm going to explain a little bit how functional medicine focuses on identifying and reducing the sources of chronic inflammation. So in functional medicine, we take a different approach compared to traditional healthcare. Instead of merely managing symptoms, we're going to focus on understanding the why behind a patient's condition. As we talked about, chronic inflammation is often a root cause of many chronic diseases and is not always obvious where it's coming from. That's where functional medicine steps in. Step one is identifying sources of chronic inflammation through comprehensive testing. Functional medicine looks deeper into biomarkers that indicate inflammation, such as C-reactive protein, homocysteine levels, and inflammatory cytokines. These are all things that we can test. We also examine gut health, food sensitivities, hormonal imbalances, all factors that can quietly drive inflammation for years. Studies have shown that gut dysbiosis, or an imbalance of good and bad gut bacteria, is a major contributor to systemic inflammation and conditions like autoimmune disease. Quick tangent, I myself had an autoimmune thyroid condition that I was able to heal by figuring out the root cause was gut dysbiosis and leaky gut. I had grown up in the 90s where there was not as much information around certain foods, and thus was on probably multiple antibiotics as a kid. And I just had a dysbiotic gut system, always struggled with gut issues. It wasn't until I became a doctor that I really was starting to feel some issues and this chronic inflammation that had been going on my entire life. And so I took a step back. I ran some comprehensive labs. I tested, I used myself as a guinea pig to what I now do to help many, many people in my practice. And so an example would be a patient with chronic headaches might find relief not through just painkillers, by identifying food sensitivities. When there's a food intolerance or food sensitivity and they eat that food, they always get a headache. And so if we can take a step back, 30,000 foot view, and start to make these correlations, we can obviously identify the root causes. Now, to speed that process up, because that can take a long time, we can run food sensitivity testing. They are pretty specific tests that are able to tell us what foods are triggering an immune response in the body. Some of the major ones being gluten, dairy, eggs, things that people eat on a daily basis. We can incorporate lifestyle and environmental assessments. We are able to evaluate the patient's entire lifestyle, including their diet, sleep, stress levels, physical activity, and exposure to environmental toxins. We can run specific tests to look at things like heavy metals, pesticides, all linked to inflammatory conditions such as heart disease and metabolic disorders. Imagine somebody struggling with chronic fatigue, and instead of dismissing it as stress related, we investigate factors like, what is the air quality in their home? Is there mold? Do they have exposure to heavy metals? Maybe an amalgam filling that they had removed that then allowed mercury to leach into the blood, or even mold toxicity, all hidden contributors to inflammation. So then what is the implementation once we've done this testing? Well, to reduce the chronic inflammation, we incorporate personalized nutrition and supplementation plans. So we create tailored nutrition strategies based on each patient's unique needs. Anti-inflammatory diets, focusing on whole nutrient-dense foods, while also eliminating common triggers like refined sugars, trans fats, processed foods, and food sensitivities. Research in the Journal of Nutritional Biochemistry confirmed that polyphenols in foods like berries, green tea, and turmeric have profound anti-inflammatory effects. Patients are often encouraged to adopt in our practice a Mediterranean-style eating pattern or a paleo approach, emphasizing healthy fats, lean proteins, and colorful, vibrant plant-based foods. The biggest thing that we see, not saying this is the only one, but the biggest thing we see is the gut inflammation connection. So addressing this is paramount to getting rid of chronic inflammation. 70% of your immune system resides in the gut. So healing the gut is key to inflammation, to reducing inflammation. Strategies include removal of offending foods, balancing the gut with probiotics and prebiotics, digestive support to rebalance the gut flora, using things like enzymes to help the body to better process food, and detoxification. Studies show that leaky gut or intestinal permeability allows inflammatory molecules to enter the bloodstream, exacerbating systemic inflammation. Now, this is something that we get a ton of questions on, and so I'm going to film a course on leaky gut and what it is so that people can really understand what to look for and how to fix this problem. So stay tuned for that. Next step in our approach is managing stress and sleep. Chronic stress and poor sleep disrupt the body's natural repair mechanisms, keeping inflammation levels high. Functional medicine incorporates mindfulness techniques such as meditation or breath work alongside sleep optimization strategies. There are certain supplements, herbs, as well as mindfulness practices we can use to enhance deep sleep, which is the repairing part of your sleep circadian rhythm. A study in psychoneuroendocrinology found that a mindfulness practice significantly reduced pro-inflammatory cytokines in stressed individuals. And then, last but not least, probably far from least, is detoxification and environmental adjustments. Removing toxins and supporting the body's natural detox pathways are crucial for reducing inflammation. Pretty much every patient I have ever worked with in functional medicine begins with some sort of detoxification because it is rampant that we have a buildup in our system of external toxic compounds that if we can't eliminate those, we're not going to even touch the inflammation. Functional medicine recommends sweating. So we used to have in our clinic, we no longer do. However, we recommend getting sweating through exercise or sauna, consuming liver supporting foods, certain herbs, and drinking plenty of water, minimizing exposure to harmful chemicals. And this is where using the apps to take inventory of your living environment. Are we sleeping on plastic sheets? Are we putting heavy chemical processed creams and moisturizers onto our face and on our skin? Toxins such as BPA and phthalates have been shown to trigger inflammatory pathways, even at low levels. These are very common in the cookware that we use. The lining of many of the pans that are non-stick contain these chemicals, and now it's getting into the food, plastic Tupperware, all these sorts of things. And so not to overwhelm anyone, but make incremental changes over time. Do one thing that works. Shift from plastic to glass Tupperware. Easy fix. And so why is this important? Why should we care? Well, functional medicine doesn't settle for the temporary fix. It aims to uncover the deeper causes of inflammation and address them comprehensively. Whether we're helping patients identify hidden food triggers, repairing the gut, or mitigating stress, the goal is always long-term health and resilience. So to backtrack and summarize, chronic inflammation doesn't happen overnight, and it doesn't resolve overnight either. But by implementing the right tools and a holistic approach, we can identify the sources, reduce the burden, and give patients a path back to vitality. This is the cornerstone of functional medicine and what we do with our clinics as well. And it's how we help people break free from the cycle of symptom-based care and truly get them back to a state of optimal health to live a vibrant, long, healthy life. So some practical strategies I want to leave you with, things that you can implement today. Number 1, eating an anti-inflammatory diet. Prioritizing whole foods, shopping the outside of the grocery store and not the aisles. If it comes in a package, don't eat it. Using anti-inflammatory supplements such as omega-3s like fish and krill oil. Prioritizing stress management. Incorporating a meditation practice. Highly recommend you look for the app called Happy-O. Happy is a app that guides meditation and allows you to not have to focus on, am I meditating correctly? Am I doing it right? They guide you through it all, and you just sit back and meditate. Getting adequate sleep and staying active. Again, 8,000 steps a day. And addressing gut health. If you think you have some sort of gut dysbiosis, if you struggle with bloating, constipation, diarrhea at least once a week, there's something going on. These are not normal. And so these are all things that you can implement today. Highly recommend that you look for a practitioner or give us a call if you want to dig deeper and find out what chronic inflammation could be doing inside your body. And so I encourage you to take inventory of your life, journal your symptoms, and not settle for a symptom-based approach, but rather get to the bottom of the problem and figure it out so that you can get back to full health. As always, you can reach out and get in touch with us at alessifunctionalhealth.com. You can book a consultation with myself or one of my team, and you can learn what it looks like to take the next step. We can guide you through the process of getting functional medicine blood work. We can guide you through the process of healthy eating and implementing supplementation. And our goal is always to guide you, lead you, educate you, and then let you go. We are not in the business of keeping people on long term, because that would mean that we are not very good at our job. If your car was always in the shop, that means the mechanics didn't fix it, right? So we want to get your car fixed and then let you go and drive. And that is our goal. So please, alessifunctionalhealth.com. We would be happy to hear from you and help you out. As always, share if you found this valuable. Share this with friends and family, anyone you think would benefit from the information. Sign up for our newsletter at our website where you can learn more about what's coming next, special events, promotions, guests, all kinds of things that we're doing within our clinics. And subscribe. This is how we grow. This is how we reach more people. You subscribing adds to our following and allows us to get this message to more people that need to hear it. Stay tuned, because next week we are going to be filming an awesome episode. We are going to be relaunching one that we did with Zeke Samples, a expert in health and nutrition and the fitness space. He is now a member of our team as well. He leads our wellness division, utilizing his Genesis protocol to help people optimize their health, lose weight in a natural, healthy way that doesn't rebound and cause them to gain weight later on. So stay tuned for that. That's going to be an awesome episode. Thank you so much for joining us. As always, stay curious, stay empowered, and remember, your health is in your hands. I'm Dr. Alessi, and I'll see you next week.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.